Hello guys, welcome back. So we are here today to discuss on nursing diagnosis formulation. Yes, following the NANDA standard, because I know a lot of students have problem when it comes to formulating good nursing diagnosis for their patients using the NANDA standard. So today I'm going to break it down for you to understand better. So if you are that person who has problem when it comes to formulating nursing diagnosis for your patients, then please watch this video till the end. So I'm going to break it down for you to understand so that from today you can formulate a good nursing diagnosis on your own following the NANDA's standard. So when it comes to nursing diagnosis, we have two types of nursing diagnosis. We have the problem-focused nursing diagnosis and the risk or potential nursing diagnosis. So for the problem-focused nursing diagnosis, it has three parts: the problem, etiology, and the defining characteristics. And then for the risk or potential nursing diagnosis, it has just two parts: the problem and the etiology. This one is not there for the risk or potential nursing diagnosis. This one is not there. This three is only for the problem-focused nursing diagnosis. So how do you formulate a good three-part nursing diagnosis following the NANDA standard? For example, a patient is in front of you, right? You can see the problem. The problem here is what brought the patient to the hospital. This is a problem. What brought the patient to the hospital? Etiology is the cause of the problem that brought the patient to the hospital, which is a related factor. The defining characteristics here are the signs and symptoms of that problem that brought the patient to the hospital. So how do you formulate a three-part nursing diagnosis, a problem-focused nursing diagnosis? For example, a patient came to the hospital with gastritis. How can you formulate a good nursing diagnosis for this problem? You can take like acute pain, right? Related to inflammation of the gastric mucosa, or acute pain related to inflammation of the lining of the stomach, as evidenced by patient verbalization of pain. Hope you're getting. A patient came, the problem is gastritis, right? To formulate a good three-part nursing diagnosis, you take acute pain, which is a problem that brought the patient to the hospital. Acute pain related to, which is the etiology, the cause of the problem, related to inflammation of the gastric mucosa, as evidenced by the signs and symptoms now, as evidenced by patient verbalization of pain, because the patient told you that he or she is feeling pain. So that's a subjective data, right? That's a symptom. So you say acute pain related to inflammation of the mucosal lining of the stomach, as evidenced by patient verbalization of pain. Acute pain related to inflammation of the gastric mucosa, as evidenced by patient verbalization of pain. It is that simple. Okay, let me quote another example. A patient came and the patient has common cold. For you to create a three-part nursing diagnosis, you take like ineffective airway clearance, because normally when you have common cold, your airway becomes blocked and it is difficult for air to go in and out of the lungs. So you take ineffective airway clearance related to the cause of this problem, the cause of ineffective airway clearance, what is causing it. So ineffective airway clearance related to nasal congestion, that's a cause. And then as evidenced by dyspnea, you can see that the patient is finding difficulty in breathing. So as evidenced by dyspnea. Ineffective airway clearance related to nasal congestion, as evidenced by dyspnea. So you take the problem that brought the patient to the hospital and then the cause of that problem that brought the patient to the hospital, then the signs and symptoms that brought the signs and symptoms of that problem, to formulate a good nursing diagnosis, a 3-part nursing diagnosis. Yes. For risk nursing diagnosis, you don't put this one. For example, you can say risk for dehydration related to frequent or constant vomiting. You don't add this one. So that is nursing. That's how you formulate a good nursing diagnosis. There's no two way about it. I think I'll end here for today. Thank you all for watching.